Hello, everyone, and welcome to our webinar and launch of the fourth iteration of our biennial report on women's ambitions in Australia, thanks to the ongoing support of AGSM at UNSW Business School. I firstly want to acknowledge, as the host, the Bundjalung people and the traditional custodians of the land on which I am streaming from today, and pay my respects to elders past, present, and emerging. Today, we will delve into the aspirations and challenges faced by women in the workplace and explore how we can create a more inclusive and empowering environment for all. This is based off our report and the responses we received from over 1,100 women across Australia. I encourage those of you tuning in at the office or at home today to ask questions throughout the session, although I have just been advised by my producer that for some reason the comment box isn't working. So if you could just use the Q&A box at the bottom of your screen to do that, that would be great. And we'll get to that at the end of the session and open up a bit of a Q&A with the panelists. And a reminder that the link to our ambition report can be found on site at womensagenda.com.au, and it will also be in our daily newsletter that will be coming out shortly as well today. So let's talk about some of the findings first, because the report does shed light on some really interesting, some really important and frankly a little bit concerning statistics, and it does highlight some of the significant gaps that still exist and some that have recently cropped up due to new socioeconomic barriers. A key point to remember, though, is that 36% of women in Australia are looking to earn more over the next 2 years, while more than a quarter of us are planning on searching for a new role. So those figures indicate the drive and determination of women to advance their careers and achieve their goals. However, factors such as burnout, discrimination, and loss of visibility due to remote and hybrid work are posing challenges that need to be addressed. Our excellent panelists today will speak more on these issues and offer insights on how to overcome them. So allow me to introduce our panel. Dr. Olivia Ong is a pain physician, author, peak performance leadership coach, and founder of Heart Centered. Olivia is a medical entrepreneur who is passionate about delivering coaching in healthcare and helping others lead balanced lives without succumbing to burnout. Her personal experience of overcoming adversity, including a life-altering accident, has given her a unique perspective on the patient experience and the importance of compassionate leadership. Professor Karin Sanders is the Senior Deputy Dean, Research and Enterprise at UNSW Business School and co-founder of the UNSW Hybrid Leadership Lab. She has a PhD in HRM and organisational psychology, and Karin's research focuses on understanding the impact of human resource management on employee outcomes. She has published extensively in reputable journals and is recognised as a leading expert in her field. Her work extends to the establishment of the Hybrid Work Leadership Lab, aimed at bridging the gap between research and practice. And Bronte Charles is a digital producer and journalist at NITV. She proudly represents her Bundjalung and Mununjali heritage. Bronte's journey has taken her across various locations, immersing her in different cultures and perspectives. She graduated with a background in marketing and media and brings a wealth of knowledge and experience to the table. Her work at NITV focuses on amplifying Indigenous voices and stories, making her an invaluable voice in our discussion today. Each of our panelists does bring a unique perspective. So Olivia, I might start with you. You've written extensively about burnout and your own personal experience.
Yes.
But as I noted before, that is a really common theme in this year's report, with 77% of respondents citing that they may have experienced burnout in the last 12 months, which is just staggering. Why do you think that is? And what do you see as the solution?
Yeah, absolutely, Tala. So in healthcare and medicine, we've noticed that this is way before COVID, that the burnout rates in doctors, I'm just speaking on behalf of doctors because that's the main research I've been doing. It's on the medical professionals. 43% of doctors were burnt out. This is way before COVID. And as we know, the last couple of years have been quite difficult for healthcare workers. Not only we're talking about doctors, nurses, paramedics, they've been, at the front line battling the pandemic. They've also having to cover for each other's shifts, like they've been furloughed by COVID. Like some of them get COVID and they have to cover their colleagues, and that adds on to that stress and the burnout rates. And I'm not surprised at the statistics that you found, Tala, because in medicine, it's pretty much the same as well. It's risen to almost close to 70%. It's about 68% across the same doctors, nurses, paramedics. We found the research is consistent across all those three particular sectors. And I will say that burnout has multiple reasons, and I want to talk about three layers. Will be intrapersonal, which is within your what's going on in your inner world, and that, and then it will be interpersonal, dynamics between you and your colleagues. That has changed because of the pandemic, right? We all know that some of us have to work from home, hybrid environments, and our relationship with our colleagues have changed. And also there'll be environmental. And I just want to go and talk about the, I guess, intrapersonal reasons. And that's all the things that's related to the mental health complications, or I guess implications of the pandemic. I think we need to recognize that the pandemic has caused some kind of trauma in all of us, collective trauma. And I have to say that what we are starting to kind of unravel in healthcare will be undiagnosed PTSD that's quite prevalent in healthcare workers. So that's something that we're starting to observe in quite a number of our staff members. And that can come from things like burnout. Like burnout itself is, there's three, I guess if I want to make a summary about what burnout is there's three aspects to it. There's that emotional and physical exhaustion component to it. There's that, depersonalization, we call it depersonalization, where you start to feel the lack of connection within yourself and with other people. You start not showing enough concern for yourself and your patients, your friends, your colleagues. It's probably quite an unsettling emotion, I guess. And the last component of burnout, which is probably the most devastating to a lot of healthcare workers, because we come into this industry we're mission driven. We want to save people, right? Most of us are like that. All of us are mostly like that. And the last symptom of burnout, which is the most devastating, will be the loss of purpose. Like they're starting to question themselves, why am I doing medicine, nursing, paramedics, fill in the blanks and all that. So all these 2 or 3 symptoms collectively together, it causes burnout. And we're starting to see a lot of that, even as the last couple of years, noticing a lot more burnout in junior doctors and senior medical leaders, because the burnout reasons for these 2 particular sectors are very different. Junior doctors were quite impacted by the pandemic. They were the ones that will be deployed to the front line straight away. And these doctors have families, have elderly parents to look after. They've got, they have a life outside medicine, and they couldn't live that life. So work-life balance was definitely not happening for them. And they have exams as well. On top of all this, exams, pandemic, I don't know how they survived that, but some of them did. That was hard. That was really hard for them. So that's that group, the junior doctors and the senior medical staff. They've had to make all the decisions about who do we take in an ICU, who do we save, who do we let go, and decisions from top down. And they have decision fatigue. They're just tired. Having to look after the junior medical staff and themselves. I think they've actually neglected to look after themselves. So the causes of burnout in these 2 groups are very different, but yet it's happening for them, impacting on themselves and their families. And we're starting to do a lot of, I guess, getting them to meet together, because I think there's still a bit of a gap between the senior doctors and junior doctors talking about the issue. So we're starting to, I guess, have lots of forums where doctors from all, I guess, career spans, if I want to call it, from interns to senior doctors, can just sit in and just talk about what the challenges they're going through. And the hospital where I work in, you know, in Monash Health, we did a lot of that. We had a lot of forums where everyone could join in, and we kind of talk about the various issues. The leaders above will just want to know how we're traveling, how are we working from home, how is our well-being, and it's nice to have that connection with, you know, the people above. And it makes a difference, really. And I think we did a lot of that as a unit in the clinic where I work in, the pain clinic, and we, even though we meet virtually, obviously, all the time, but we try to have like a social events now to kind of reconnect again.
I think that, you know, you've noted some really interesting examples that are happening in the health profession, which we know is overburdened by burnout, and that's just become such a prevalent, trend that's taken place across care professions, in particular. I mean, I guess what is really concerning now is that, you know, it's seeming to take place across all professions. And that's, you know, with the statistics that we found, as 77% of women respondents from across industries noting that. Karin, do you want to maybe allude to that a little bit and talk about, you know, some of the things that you think employers can do to better support women on their teams, or even policy changes?
Before I answer your question, I want to compliment you with the report. I think you did an excellent job, and it was really lovely to have a look at it and to compare it with the report 2 years ago. And then you can see that the burnout is indeed becoming really a concern. And on the other hand, what I really liked in the report was the information about the hybrid work. People are working more from home, and it would be good to connect those two. Because I can see, and you were talking about it, that the burnout is not only in a couple of occupations anymore, doctors or teachers or nurses, from which we knew that for a long time that they were always high on burnout, but now it's all over the place. And I completely agree that the pandemic was a very difficult one for all of us, male and females, but you can see that females, it seems that they are more or less the victims of the pandemic, having more issues than males. And if you go back to the pandemic, and I guess we all recognize it if we have a look at our networks, when couples were working from home, it was always when there was a small apartment or there was a study and a bedroom. The man was the husband, the male partner in the couple was always occupying the study, making it difficult for females to have an own room. So what was happening, that for men there was a clear boundary between work and life, because they had the study for work and the living for, okay, now it's work over. And females, they moved to the kitchen table, and they didn't have the strong boundary between work and life anymore. And we know that burnout is one of the factors that can happen if there's not a clear boundary. And when the homeschooling came, and there were children in the family, it was almost logical that they were sitting at the kitchen table as well. And it was continued that the females were struggling to find time to do some work, while the male, the man had the study or had the bedroom, if it was really a small house, so they could close the door, focus on their work, and females struggled to find a place. And we can analyze the data more, but I'm almost sure that there is a higher relationship between having the burnout and the hybrid work and what was happening during the pandemic. And then if we move further to how many people are working in a hybrid way, working from home and working from the office, it would be lovely to see if there's a connection between the two. And I'm sure we are going to talk more about it, but maybe it's good to leave it for now.
Yeah, I mean, absolutely. I think that there is definitely room for further analysis across the board on this, and it's, you know, such a big area. We're definitely going to get back to some questions around the hybrid work, you know, phenomenon, and whether or not it really is, you know, leading to the kind of flexibility and support of women that we want to see, or whether it is actually another barrier. But Bronte, I want to bring you in here first. As a young woman starting out in your career, you have, you know, publicly commented on some of the big ambitions that you do have in your career. After reading this report, or you know, perhaps through other, you know, like reference points in your career, is there anything that is standing out to you as you know, a concern for you, and a potential barrier now or in the future?
Yeah, for sure. So I think what was interesting for me from the report was that racial discrimination was ranked quite highly as a barrier for women. And that definitely resonates with me, you know, as an Aboriginal journalist in the media space. There's not a lot of representation, particularly Black women in the space. And I guess you can't really be what you can't see. So I think that has been a barrier for me. You know, I'm starting out in my career. It's my first year, full-time work, which has been a big shift. But I think, yeah, representation has definitely impacted my confidence. Not hearing from people who talk like me or look like my mother and my grandmother has definitely, I guess, heightened my imposter syndrome. Some days I feel like I'm not good enough. Some days I compare myself to other people in the industry. And I guess one of my concerns is I feel very grateful to work for NITV, which is a Black media organisation. But I guess one of my biggest fears is if I want to go to, you know, the ABC or a network, will I be valued in the same way that a non-Indigenous journalist would be valued? And yeah, I guess it is really interesting to see that racial discrimination is such a high barrier in the report, because I feel that it's real, and I think it's affecting young Aboriginal people entering the workplace, young Aboriginal women entering the workplace, because for most of us, we're the first in our families to go to university to take up these spaces. And I guess, yeah, racial discrimination does play a role in even the organisations we choose, what we choose to do, what careers we choose to take on.
Yeah, I think that's a really critical point, because, yeah, as you know, close to 5% of those surveyed in this report noted that racial discrimination was a barrier for them in getting to where they want to go. Bronte, I want to ask, so Indigenous women with caring responsibilities are also more likely to feel unsafe at work and less supported when hit by racism or unfair treatment. How do you think we shift that, and what can progressive employers do?
Well, I think of my mom. She has recently re-entered the workforce after taking a long time off to look after me and my little siblings. And I'm so proud of her. I'm really, really proud of her for taking that step. I know I get emotional, but I know it's been challenging for her to re-enter it. She's been out of it for quite some time. I don't know. I think for my mum, I've seen she still has those caring responsibilities, because my little sisters and my little brother are still pretty young. They're in primary school. And I notice her, you know, taking on extra work, staying back longer, because I guess she feels really insecure in having those caring responsibilities. But I think for employers, it's really important to acknowledge that our kinship ties, our family ties, they're not, a white system isn't built for them. it's different. And I think for progressive employers, it starts with representation. You know, in my team, we're made up of mainly Black media professionals. It's as simple as saying, I got to look after Nan, I got to look after my sisters, and my boss just gets it. So I think, you know, having Aboriginal people take up leadership positions where you don't feel shame, you're not embarrassed, they have that understanding because they're impacted by those caring responsibilities is a first step.
Yeah. Beautifully said. Karin, I want to go back to the point that we were talking about before around the research indicating that hybrid or remote work has become the norm for many Australian women, with 42% of them suggesting that they work this way every week. But there appears to be substantial consequences associated with this flexibility too, with 37% of those in remote or hybrid work saying that their lack of visibility to management is hindering their career, and 16% suggesting it's affecting their chances of promotion. Why do you think that is? And what is the answer? Because clearly hybrid work is here to stay.
Yeah. I completely agree that hybrid work will not disappear because especially if you have a look at the labor market, people nowadays want to work hybrid, and it is the question in every interview, can I work hybrid? And if organizations are not positive answering that question, then they end the interview and they go to another organization. So organizations, it's clear they need to offer hybrid work, and they need to accept if people want to work 2 or 3 days a week. And we see that all over Australia and worldwide. So that is not an issue. What is an issue if we talk about gender is that in general, men are having a schedule of 3 days hybrid work, 3 days in the office, 2 days at home, and females have in general just the other way around, 2 days in the office, 3 days at home, because then in general, and it's really stereotyping, but they have more time to be flexible and compare caring and responsibilities with work. On one hand, 2 or 3 days is not a lot of difference, but you can put it in another way. If you are 3 days in the office, like most men who are in hybrid, that means that you are more visible because you jump more. If you are in the corridors and there's just your supervisor, oh, hi, good morning, good afternoon. And if females are only 2 days in the office, that means that they are less visible. And what is important for many decisions for promotion is the visibility. So they are just losing 1 day, and that is an issue. It can be that maybe the hybrid work now is a very good solution for females now, but it is not a good solution for the long term, for the next promotion. And I think that is really concerning, what we seeing now and the long-term consequences in terms of gender differences. It almost looks like men are much better coming out of the pandemic than females. And I would love to see the numbers for burnout for men. I guess that they are high as well. And you mentioned some numbers coming back from care responsibilities, maternity leave, and you report in your report that they struggle as well. So it can be that they struggle as well. Your last question, and maybe the most important question, how can we solve it? It's a difficult one, and I'm not eager and not a big fan of top-down decisions, because everyone should have the autonomy and the right to, if there's hybrid, how many days from work and how many days at the office. But maybe, and I wrote a column about it beginning of the year, maybe in this case we need to be much more top-down and tell everyone hybrid is okay, but you are allowed to work 2 days from home and you are all 3 days in the office. because then there is the same visibility. It's the same for females and male. Maybe that is a solution.
Yeah. I think, one of the issues is that we have focused so heavily on what the positive benefits are of hybrid work. And there are many, we know that it enables people to get things done on their terms and in their own space and in their own time. But there are considerable drawbacks that we haven't actually properly considered yet. And there obviously needs to be a lot more digging done in that regard. Olivia, did you have any comment on that as well?
Yeah, I just want to kind of echo what Karin is saying about females. Obviously, the females are having to bear the brunt of the pandemic. And, according to the burnout studies, I know that about close to 70% of physicians or doctors are burnt out, but more than half of them are females. And it'll be exactly that, like female doctors have kids. They have to do, they still have housework to do. It's not like, like it's not going to like get it done by itself. And they have lots of responsibilities. And I guess in the medical workforce, it's a little bit different because a lot of us have to be in the hospital. Like if you're employed in the hospital, you have to be face to face. But like for my case, I'm a pain physician, so I had the autonomy and the choice to work just pure, like mostly telemedicine, because that's my choice. I have a disability. I have a spinal cord injury. I chose that, and my employers were really supportive of that. So I think it takes two to have a discussion. Supportive employers and the choice of the worker herself, like what does she want? If she, like the pandemic, we probably have introspected a little bit more. I'm like, hey, maybe I'm not seeing my kids very much. I want to see them more often, and they choose to have that hybrid, more the working from home and less the being in the office. But I can see where Karin's coming from about career advancement can be quite difficult if they're less visible, because you have to be visible. So certain areas in maybe corporate medicine might be that you need to be more visible. But yeah, so that's my take. Hospitals might be a little bit different because most people have to be on site. But yeah, there's some of us who had the choice to work from home, and yeah, so I definitely want to echo. Yeah,
I think that's, those are really good points as well. Maybe making one of the solutions is around making it more ubiquitous for men and women to take remote work and to enter into that hybrid work, because I suspect and I think a lot of studies are pointing to this at the moment, is that men are still working predominantly from the office, while women are the ones that are taking up those remote work opportunities. And the reason that they're doing it is to manage lots of different competing life priorities and the care load and the domestic load. So it's already, heightening what was already happening before.
But maybe on the other hand, if I may, what is always striking to me, and maybe in a way the lovely story about your mother, Bronte, going back to the labor market. Sometimes I have the idea that women have children and men don't have children. That is not the case, of course. Why is it every time we talk about caring and responsibilities for women and not for men? And maybe I'm from the Netherlands. I'm Dutch. And there the differences between women and men are smaller. So it was always very logical that my husband was taking care of the children as well. We were much more a team. And if you are looking back, his father did a lot of work, which was not that common at that day. But it's really having the example. And you were talking about having an example as well. I think that is so important. And now you see our two boys, they take on the responsibilities. So I'm always puzzled how it can be that only women have children.
Bronte, as maybe you can comment on that from a young woman's perspective, do you see that kind of generational shift happening with your male peers? Do you see them wanting to kind of take on those responsibilities more, and also to be involved in kind of sharing that mental load?
Yeah, my boss, literally, he's the stay-at-home dad. Like, he works from home every day, comes in once every 2 weeks. But I think the perception of that is really interesting, because when I've noticed when a man does it, when a man stays home, we kind of go, oh, that's good. But when a woman does it, we think, when a woman's late to a meeting, for example, because she's had drop off, we think, well, you should have managed your time better. So I think that perception,
Yeah.
I don't know, that might just be me, but I don't know.
No,
Have you guys noticed that as well?
it is.
Yeah, I think that's pretty spot on, to be fair.
Yeah.
And I think that goes back to gender roles as well. And what we've seen, we applaud men for taking on those gender roles, but in the reverse, when, you know, women want to be the breadwinners, kind of the perception is kind of like, well, manage your time better, hurry up with drop off and stuff like that.
Yeah. I've talked about this a lot, and bless my partner if he watches this webinar, but I get praised so much or congratulated all the time for having found a partner that's willing to take on, you know, half the parenting load. And it's just such a funny thing for me, because I swear it happens to me all the time. You know, people are just so incredulous about how that could possibly be the case, despite the fact that we both work full time. You know, it's still very much I'm the lucky one for having found this unicorn. And I think it's a huge thing that needs to shift.
Yeah. I completely agree. It was always, if my husband went home earlier for picking up the boys, excellent. And I never told people, because I just told people I have another meeting, because it's still the case that if you tell people you need to pick up your children, then for females, you are not organized. It's clearly that you need to do something to be more organized. So there is still the difference. On the other hand, and I always tell all my PhDs, if you want to have a career and if you want to have children, then be aware that you pick a lovely husband, but who is willing and who is have the idea, of course, it are my children as well, and I take part of it. So sometimes I see too often young females, and especially PhDs, who want to have a career in academia, which we know that are long days, and working in the weekends, working at home. If you have a husband, or you are dating, and that person is telling you, well, for me, it's really important that the woman is taking care for the children, end it.
Yeah.
Because and maybe that's too irrational, but in a way, your choice for having a career, having children, having a husband is in a way rational. I know there's love, of course, and I don't deny it, but don't believe that someone is changing. If someone is telling you, oh yeah, maybe I can do some part for the child, for the responsibility for the children as well, but for me, my work is most important, then all the alarm bells should be ringing.
Yeah, absolutely. Bronte, I want to go to another big kind of statistic that came out of the report, and you alluded to this feeling of imposter syndrome, which apparently is similar for 40.99, so nearly 50% of women, 41% of women, I should say, citing that one of their dominant hurdles in achieving their ambitions was confidence. Why do you think a confidence deficit persists for women in their careers when we are more educated, when we have greater opportunities than ever before? Why, and do you think that that's true for younger women as well?
Yeah, I think it's important to acknowledge that there's still a systemic bias that is quite visible among young women. But I think, and I know speaking on behalf of myself at least, it's more of an internal battle. You know, the way we perceive our abilities are not the same as our actual abilities. You know, I think I don't know, I feel like men are so comfortable in talking about what they're good at and women aren't really. But I think, I don't know, to combat that, what I've done at work is I have such an amazing, you know, network of strong women at work, strong older women who really believe in me, and I think that's really helped my confidence because they've been on similar journeys as me, and we uplift each other, we encourage each other, and it's just, I don't know, those relationships have been so important in the development of my own self-confidence and own self-belief. They've really been a lifeline. Like, I've really relied on the women at work. So I think it is hard. It's an internal battle for sure. But having women you can talk to about it and who can, you know, lift you up has really helped me as a young woman.
Yeah. I think the importance of mentors, like you noted, but also on sponsors, which is a growing area of understanding among organisations that you know, women and lots of different minorities and diverse people need to be pushed up through the ranks, and they need to have you know, an advocate in their corner that's willing to do that. So I think that's a really critical part of it as well. Dr. Ong, I'll go to oh, sorry, Karin.
If I just because mentoring is one, having a female network is another, coaching is another. And if you look, and we know that from psychology for decades, that there is a difference between women and men, how they attribute what they are doing in different ways. So, and it's quite stereotypical, but maybe many people will recognize themselves. Females in general, if they do something good, they attribute it, okay, maybe I was lucky. Men, on the other hand, when they do something good, for instance, you have a high mark, you are writing an article and receive many compliments, men in general attribute that to internal factors. See, I can do the job. That is creating confidence. In the other way around, if females are making a mistake, and we are all making mistakes. So, for instance, you make a mistake in an article, then females in general are much more attributing that mistake to internal factors. Oh yeah, maybe I cannot do it. Oh, maybe they recognize that this job is too difficult for me. Men, on the other hand, if they make a mistake, they always attribute it to external situation. Oh, it was the supervisor. Oh, someone else made the mistake. And you see that pattern, although we know it for 40, 50 years, you still see it happen. And if you continue in that pattern, that good behavior you attribute to external factors and not to yourself, and you do it the other way around, then you don't build up your confidence. And that is a trick you can learn in mentoring, in coaching. So if you just learn yourself, for all the young and females who want to have a good career and missing the confidence, just start that every time you do something good, tell yourself, this is because I can do the job, because I am strong, I can do the job. And just try to, every time there's a mistake, tell it it's not your fault, it are other people, or it's just the circumstances, external factors. And that can help to build confidence.
And if all else fails, just look around the room at all the mediocre men that are giving themselves a pat on the back every day. Dr. Ong, a staggering 57% of the respondents to this survey who had taken time out of work to raise children in the past 10 years said that they had been discriminated against for needing to work flexibly or part-time. What are some of the key steps employers could take in this space to ensure the need for flexibility is met with understanding and respect?
Yeah, I see this happen a lot in medicine, especially female doctors who want to pursue careers which are quite men-dominated, like surgery and all that. So obviously, you know, for them, and they want to have kids, and we're allowed to do that. We're allowed to get married, have children. That's kind of normal, right? But I think it's cultural. It's probably societal. It's that patriarchiness. That's probably not a word. Patriarchalness or patriarchy nature of the way the colleges are. We're talking about specialty colleges like surgery, emergency medicine, and all that. And I think just raising awareness about this is actually going on. So a lot of my female colleagues, physician colleagues, are actually very vocal about this, and they're starting to stand up for themselves, and also for their specialty in general. So there's a lot of female voices speaking out loud, saying, "Hey, you know, we have a voice here." So that is one. I think collective voices and having a community to raise this awareness to the people who are seemingly quite blind to the whole thing, or pretending to be blind. I don't know, but to the whole issue of this discrimination, which is probably unbiased, it's subconscious, it's there, and we know it's been there for hundreds of years. And that I think, you know, Karin and Bronte have alluded to, like the expectations of the female gender, what they expect it to be, and we're seeing a lot of role reversal now, and all that. Yeah, awareness is one, acceptance is another. The transition from awareness to acceptance, a little bit challenging. Because of their own beliefs, unconscious biases, and their patriarchal nature, that kind of thing. So that's that. So I think just, you know, like having the two, like the employers, the people who want to change, to meet and have a conversation. That's all I think it needs. Well, maybe that's simplistic, but I think that's a starting point, just having a conversation together and raising the issues. Yeah, I think that's really important, like a forum type of thing, which we're kind of doing in hospitals now. Is one way we can do it. Be interested to hear about people in other industries, how they're doing that.
Yeah, absolutely. I think, you know, and you kind of mentioned this then, but just in normalizing flexible work, it's one thing for employers to offer it as a policy, but then to really embrace that as you know, a key part of that organization, and a key offering that is offered to everyone, and for those feelings of, you know, judgment to be eradicated, because I agree. I think that's a huge part of it, and you know, a massive deterrent for men to take up flexible work, and a huge barrier for women who have to. So one of the stats around that, which I think is really illuminating as well, was that 62.89% of women feel overwhelmed about balancing their career and home responsibilities. Karen, can you maybe speak to that a little bit, and why that kind of level of overwhelm does persist?
Yeah, and for me, it is related to the burnout question, because it's so connected to each other. And when I was reading the very high number, I felt pity for all those females. It's clearly that we are doing something wrong on the labor market. We are asking too much from females. So I'm making it almost impossible to combine a career and having children. That should not be the case. It should be just logical for people, men and women. If you want to have children, there should be an opportunity. And you need to have role models, of course, but the high percentage that find it overwhelming is very scary, in my opinion, and very concerning. Because if you don't have the idea that you can handle it, that you have the idea that it's all becoming too much. That is not good for your work. That's not good for yourself. It's not good for the children. Females and males should have the opportunity to go to work, have the idea I have a purpose, because that is one of the elements of burnout. And I feel very sorry for people who don't have an idea of purpose when they go to work. But you also need to have a pleasure to combine, to do more activities at the same time. At least when my children were younger, I really enjoyed being sometimes out and go to a conference and doing my job, because I really had the idea I became a better mother of it. Maybe I was not a good mother to stay at home the whole time. So I feel pity, and I have the idea as employers, we need to talk to them and see how they can do it. And a topic which is not in the report, and we were not talking about it until now, is what I really like is the 4-day work week. And maybe it is not for us, because in a way, at least if I look at myself, it's easy for me. My children are older. I can move some work to the weekends. I can move some work to the evening. So it's less important when and where I work for me. But there are many occupations, jobs, they don't have the opportunity to make a decision when and where to work. And then your occupation, Olivia, is one of them, but teachers, nurses, even the people in a supermarket, they need to be there. And that makes it even harder. And you see that all the experiments for giving people a 4-day work week, having the same amount of salary, but only having 4 days, and not meaning 4 days that they have work days of 9 or 10 hours, but really just having 7.5 or 8 days, they are in the same way productive. They feel better. They are more committed. The turnover is less. So for many occupations, I have the idea that the 4 days work week, and it's not for me. I think for many people in academia and many other jobs where you have the autonomy and the freedom to move when and where to work, but there are many occupations they don't have the autonomy. And then you see really huge differences and excellent results for the 4 days work week. And maybe that is a solution to feel less overwhelmed, to have less burnout.
Yeah. It probably points to the fact that there needs to be more work done from a government policy level as well, on structures that can make women's lives and families' lives easier, and to alleviate some of that overwhelm that is being cited here. So whether that's increased paid parental leave, or we know that there's been considerable work done to the childcare policy at the moment, but these are all factors that come into play as well that add to this. So a closer examination of all of those policies all the time is necessary. Bronte, I want to go to another question around, and you kind of mentioned this before, around the cultural load that Aboriginal and Torres Strait Islander people experience, but also women of colour, and their workplaces really relying on them to carry extra loads around making workplaces culturally sensitive. Is this something that you can relate to, and how do we push against that kind of cultural load that has been noted in the report as well?
Yeah, 100% actually. In previous roles, being expected to do acknowledgements of country before every meeting, being expected to sit on RAP committees, spearhead cultural initiatives, things like that are outside of my job description, but take, you know, a good chunk out of my day have, yeah, definitely affected me. I think that if you expect, you know, Aboriginal and Torres Strait Islander employees to do to take on those sorts of cultural load, which is outside their job description, then they should be compensated for it. There was a really fantastic article in the Sydney Morning Herald at the end of last year about how, I think it was the University of Tasmania, they're starting to compensate Aboriginal and Torres Strait Islander academics who, you know, take on cultural load within universities. And I think that is a very good solution because, you know, when we take on cultural load, I think for me, at least as an Aboriginal woman, I'm thinking, well, am I here because I'm good, or am I here because I'm a good Aboriginal employee? And yeah, I think, you know, we already have to carry around our cultural identities at work and navigate these colonial spaces, which are already hard to navigate. Taking on extra, you know, cultural load is just, I think it's just asking too much.
Yeah.
I think also that comes with it is the fear, you know, if we don't take on that cultural load, will there be culture in the workplace at all? So then we feel pressured to take it on because out of fear that it just won't be there if we don't do it.
Yeah, absolutely. I think, you know, it's important that employers are trying to do more and to embrace, you know, cultural awareness and cultural inclusivity, but to you know, expect that, you know, Aboriginal people of minorities, women of colour are the ones to carry that load all the time is just, you know, it's not the right way forward. And I think that you know, comment around compensation and making sure that there is, you know, really kind of deliberate moves in that regard is really important. I am conscious of time because we are running this till 1, and I have some questions from audience participants. So I want to go to a question from Rosemary Johnson around the issue of visibility and not having spaces at home to work at home, which you talked about, Karin. What suggestions do you have, and does the rest of the panel have perhaps, around changing male attitudes to take more of the caring roles in a relationship and in an organisation, acknowledging women's contribution so that women can achieve their ambitions more easily?
It's a difficult one. On the other hand, I have the idea that if men have that attitude that work is for them more important and that females are there for the children, they are missing the opportunity to enjoy their children. And they should be much more aware. And maybe it is already changing a bit, but you have a responsibility, not as an employee, but also as a father. And that is not only the responsibility for bringing in the money, you also have a responsibility as being an example. And especially for boys, if we continue to give them the example that men are working outside and females are much more inside, then that is not changing anything. So you cannot force them because that's not working, but you can show them that they are missing an opportunity to be a good dad for their children, and that taking care and enjoying time together and learning to know who your children are is not a responsibility you need to do, but it should be a pleasure and it should be an opportunity, and you should be happy to do it.
Yeah. I'll go to another question now from Judith Boutel, and she is asking the panel to speak about the personal risk that women and people from diverse and marginalised communities take when they enter organisations that are inherently and systematically set up for the privileged in our society. That is the risk of meeting sexism, racism, ableism, homophobia and transphobia. How do we change the environment rather than turning back to models of self-help and personal responsibility that can only go so far to affect widespread change? And I think that's a really important point that Judith has raised there, because, you know, so often the conversation and the literature around this is around fixing women and fixing marginalized communities so that they can operate within these structures. But how do we change the structures themselves? Dr. Ong, I'll go to you first on that one.
Yeah, this is a really good question, because I see this a lot in clinical medicine where, you know, I have patients who come, I guess, from countries that are war-torn countries, and they're expected to just fit in our society just like that. I think we can do better as a society in general, and actually getting to know what they actually truly need and actually having a conversation with them rather than speculating and all that. So I see this a lot. Like there are some of my patients are really quite, like, you know, they've had car accidents and workplace injuries. Like, what can, like, and they're expected to adjust to that legal system again, in addition to adjusting in a new country. So I think having a conversation what they need, what supports they need. Yeah, just having more conversations. I know it's quite a simple, no, not, it's like a simple answer, but just having conversations with them and
not assuming.
And not assuming, exactly. And then
yeah,
working with like-minded people who are very interested in helping the marginalized people to achieve what their needs are. And that's how it started. We have this thing called Foundation House in Melbourne, where they help people, the Afghan refugees from Afghan and many other war-torn countries. They provide not just counseling services, physiotherapy, they also provide like actual personal support, financial support. And yeah, really, they really understand that particular I guess society, culture and society, and it will be something like that. And I'm sure they started by just speaking to the, you know, to those people who are in need and what their actual needs are from us. So that will be one example.
Groups, yeah,
exactly, working group. That's the example I can think of on the top of my head about what I see in my clinical practice, how we kind of try to help our patients out in that marginalized population, just understanding where they're coming from.
Yeah, I think that's a good point. Bronte, do you have any thoughts on that?
Yeah, I think this is such a great question. There is such a big personal risk when you walk into systems that are just not for you, like, period. I think that it is something that, you know, these organizations need accountability. You can have accountability, I think, with this, you know, having these groups in leadership positions that helps dismantle these systems that have historically and still to this day, you know, value whiteness and value these privileges that exist in Australia. Yeah, I think it starts with appointing people from these groups in leadership positions, acknowledging it, you know, because I think the I guess systemic racism or systemic, you know, sexism is so hard to combat because it's so insidious in nature. It's hard to spot because it's so ingrained in our systems. But I think, you know, having more awareness around it and being able to acknowledge it is the first step. Yeah,
absolutely. Okay, I want to go to one last question, which I will throw out at all of you. Because unfortunately we have kind of come to the end of this panel, but just a note to everyone that's tuning in that we will have the report up on site. I've also added it in as a link there in the conversation page, the chat page rather. And we will have further kind of analysis on this report coming up in the coming months as well, with a further white paper around a roundtable with organisational leaders. And also just to you know, ask any questions. We'll have the recording on Women's Agenda and across our YouTube page as well. I know a lot of people have emailed us about being able to access that after the fact, so it will be up there. And please do you know, email us at contact us at womensagenda.com.au with any other questions that you've got here, and we can try to get that across to the panel and get some response to you as well. But my last question to everyone, and that was a very long preamble, is if we have any last advice to women who have big ambitions but are finding it increasingly challenging keeping on track with them in this climate. Dr. Ong, I'll start with you.
Yeah, you know how we were just having that that conversation about imposter syndrome. And I think with imposter syndrome is quite an interesting thing, because when we have that imposter voice, it means that we care enough about something that it actually bothers us. It's because we care a lot. And Karin was talking about burnout in females. And I think females just care a lot more than men. Like they're just more empathic, more compassionate. And that's probably one of the kind of intrapersonal causes of burnout. It's just females, we spend the time to listen to other people, and we actually are very we spend a long time listening to people and offering advice, offering this and offering that, and that's probably why we burn out too. But coming back to imposter syndrome, just acknowledging that when that comes up is actually a good thing, because you're going up to the next level, you're going to the next stage of confidence and up leveling. So learning to embrace the imposter voice is probably the next step for ambitious women to kind of still believe in themselves and moving ahead. So that will be what I think about imposter syndrome and everything else. Yeah.
It's interesting you just noted those values of communication, empathy, and resilience. Yes. They were the top three traits that were noted by respondents of this survey of, the most critical leadership traits in the future. And interesting to hear there your perspective that, women are more hardwired to lead with those traits, and that they're not necessarily something that we want to be trying to kind of squash. They're important. Karin, can you share your thoughts on that question as well?
Yeah, I love the question, and I am well aware of the time. So because I think we can have another hour to talk about this question. I would like to advise all the females who have career ambitions, just continue to follow your dreams and find ways to find your dream and work for it. And sometimes it can be difficult, but don't give up. And on the other hand, if you are in a situation where there is an awful environment in your workplace, just leave and find another job. And I think the labor market is on your side now, because you have the opportunities to go to another organization and just continue what you want and be authentic as much as possible. Stay who you are.
Bronte.
I love hearing these because I feel like I need them at times, so thank you. I think something that I remind myself of every day is just the strong women who have come before me. They would have dreamed to have the opportunities that I have, so I try everything I do, I try and do it for them. And yeah, you can do it. Like I'm a young girl from Housing Commission. No one in my family had gone to uni before. No one in my family had taken up spaces like these before. You can beat the odds and do it if that's what you want to do.
Yeah. Thank you all so much for being part of this discussion today. And it's been such a pleasure to hear your insights on these findings and to kind of give it more analysis. I really appreciate everything that everyone's said on this, and hopefully we can have you involved and back to talk on the findings in another couple of years. So so Bronte Charles, Dr. Olivia Ong, and Professor Karin Sanders, thank you very much.
Thank you.
Thank you.
And thank you to everyone who has joined in today. And a reminder that, the recording will be up on Women's Agenda. The report is now up on Women's Agenda. And we look forward to hearing everybody's, thoughts on some of those findings, as well as other people's experiences on what we've looked at there. But thank you very much.